Patient Anna Steele is a 64-year-old woman who was rushed to the emergency department and was diagnosed with primary open-angle glaucoma.
Let's take a closer look on what is all about primary open-angle glaucoma.
Open-angle glaucoma is the most common form of glaucoma, accounting for 90% of glaucoma cases. It has a wide and open angle between the iris and the cornea. It develops slowly and is a lifelong condition. It has symptoms and damage that are not noticed.
Pressure builds when the drainage system is blocked. This increases pressure that presses against the optic nerve and causes a gradual loss of sight. Also, Mrs. Steele's history reveals that her mother also had glaucoma.
For the manifestations, Mrs. Steele manifests blurry vision, headaches, pain in both eyes. She also sees angel halos around lights. Her intraocular pressure is 28 mm per mercury, which is high, and her peripheral vision has dark areas, and it makes her have problems discerning and paying attention to the figures around her environment. The diagnostic tests and findings: Mrs. Steele underwent tonometry, which is a diagnostic test that measures the pressure inside the eyes. Tonometry results showed an elevated intraocular pressure at 28 mm per mercury. So the physician also notes in the visual exam that her optic disc appears pale, and the depth and the size of the optic cup is rather increased.
For the medical or surgical interventions, patient Steele was given initially the following medications to treat the disorder: Celotan eye drops, 1 drop on both eyes once a day; Cetamide 250 mg, 1 tab per rm once a day; Timolol eye drops, 1 drop on both eyes twice a day.
Determine the kind and severity of vision loss, because it has an impact on the interventions to choose for the patient's future expectations. Allow for the expression of feelings related to vision loss and the possibility of vision loss. Even though early care can avert blindness, the patient is at risk or has already partial or complete vision loss. Implement measures to assist patients to manage visual limitations, such as reducing clutter, moving furniture out of the way of the patient's travel path, swivel head to observe subjects, and correct for dim light and night vision issues. To reduce the risk of accidents caused by changes in visual fields or visual loss, as well as the papillary adjustments to the environmental light. Demonstrate how to properly use eye drops, counting drops, adhering to the schedule, not missing doses, to control IOP, preventing additional vision loss.